Every day you do crunches until you can barely breathe. You've cut carbs, counted every calorie, tried every diet that promises you a flat stomach.
And your belly still sticks out. Let me tell you something that will change the way you look at your own body forever.
90% of women who experience painful sex, swollen legs, and varicose veins have been told it's genetics or hormones or just how their body is. That is wrong. Dead wrong. And the real cause, the one nobody is telling you about, is sitting right inside you, pressing outward right now. They're not going to say this at your next checkup. The system gets paid when you keep coming back sick, not when you get well. Subscribe and hit like if you want the truth.
Help Dr. Waterling reach 100,000 subscribers. Let me walk you through what is actually happening inside your abdomen.
Most people look in the mirror, decide they eat too much, and conclude that if they just locked their jaw shut, the belly would disappear. I understand that logic. I also see it fail every single day in my clinic, because the anatomy tells a completely different story. Let's talk about the front abdominal wall. The layers between your skin and your organs. Yes, there is a layer of subcutaneous fat there. Subcutaneous fat just means fat that sits directly under the skin. In a lean person, that layer might be 2 to 3 centimeters thick. In a person with significant excess weight, it can reach 10 centimeters. 15 centimeters of subcutaneous fat is extraordinarily rare. That is end-stage severe obesity. But I see patients every single day whose belly protrudes, far more than any fat layer could account for. The volume sticking out is many times greater than what subcutaneous fat alone could produce.
Which means there is something else, an internal force, pushing that belly forward. We can immediately rule out pregnancy.
Pregnancy is the one physiological reason a belly should protrude. A healthy, entirely welcome reason.
But if you are not pregnant, the structure that is pushing your abdominal wall outward is your intestine, your gut. Under normal, healthy conditions,
The gastrointestinal tract, your stomach, your intestines, your colon should sit in a firm, well-supported position inside the abdominal cavity. The ligaments and connective tissue that hold everything in place keep your organs lifted and organized. But when those supporting structures weaken, the intestine descends, it drops. Doctors call this visceroptosis, which simply means prolapse or downward displacement of the abdominal organs. Once the intestine drops, it needs somewhere to go. The pelvic cavity is not elastic.
It cannot expand infinitely. So the gut does the only thing it can, it pushes forward, and your belly protrudes.
This is the core insight that changes everything. You are not fighting fat, you are fighting gravity. The real battle is about restoring the correct anatomical position of your intestine. When the intestine rises back to where it belongs, it stops pushing outward from the inside, and the belly flattens. Not because you lost weight, but because the mechanical pressure is gone. I have watched this happen in an enormous number of patients. They learn one specific exercise, they change nothing in their diet, not one meal, not one calorie, and within 3 to 4 weeks, their belly visibly tightens and flattens. This works in men and in women. It works in people who are very lean and in people who carry extra weight. The before and after results are genuinely striking, and the timeline is 3 to 4 weeks
Of daily practice, no starvation, no supplements, pure mechanical physics, lifting the intestine back into its correct position.
Now let me explain why this matters so much beyond how you look in a mirror. Because the consequences of a prolapsed intestine are serious, systemic, and clinically devastating. When a heavy, descended intestine sits in the lower abdominal cavity, it acts like a hydraulic press.
Think of it this way. The major veins that carry blood from your legs, pelvis, and lower abdomen back up toward the heart run right through that space. Venous blood, the blood that has already delivered its oxygen and needs to return to the heart for recycling, flows upward through those vessels.
When a prolapsed intestine compresses those major veins, blood flow backs up, it stagnates. You get a dam effect in your entire lower body.
What does that look like clinically? You get heavy, persistent swelling in your legs. You develop progressive varicose veins.
the swollen, twisted, visible veins that bulge under the skin of your calves and thighs. You develop hemorrhoidal vein enlargement.
Hemorrhoids are essentially varicose veins of the rectum, and the same venous stagnation drives them. In women, the uterus becomes engorged, and with blood because the venous outflow from the pelvic organs is obstructed. That engorgement directly causes abnormally heavy, prolonged menstruation. Periods that last 5 to 7 days instead of a normal 3 to 4, with excessive flow that exhausts you. The problems continue. The descended intestine rests its full weight directly on the bladder. That pressure on the bladder manifests as urinary urgency, the constant feeling that you need to go. It causes nocturia, meaning you wake up multiple times at night to urinate. It causes stress urinary incontinence, meaning you leak urine when you cough, sneeze, laugh, or exercise. These symptoms are dismissed so often as just getting older or just having had children. They are not inevitable. They are mechanical consequences of a displaced organ. In women, when the prolapsed intestine presses on the uterus physically shifts out of its correct position.
When the uterus tilts or displaces, penetration during intercourse creates traumatic, too close contact between the partner and the cervix.
The cervix is the lower opening of the uterus, a highly sensitive structure that, when impacted directly, causes sharp, significant pain. 90% of cases of painful intercourse in women are connected to this exact mechanism: organ prolapse, not psychological issues, not lack of lubrication, not simply sensitivity. 90%. That statistic should make every gynecologist stop and reconsider what they are telling their patients. And the intestine itself suffers. When it is displaced downward and compressed by its own weight, its function degrades. Transit slows.
You develop chronic constipation, difficult, infrequent bowel movements that leave you uncomfortable and bloated.
You develop chronic abdominal bloating, the feeling that your belly is always distended and full of gas.
For pathogens, inflammation develops more easily, and parasitic infections take hold more readily, which further damages digestive function.
Now here is the clinical reversal. And this is the part I want you to really pay attention to, because this is what 15 years of watching patients recover actually looks like. When we mechanically lift the intestine back into its correct anatomical position, the improvements are rapid and they are real.
Varicose vein progression halts. Leg swelling visibly diminishes. Patients stop waking up at night to urinate. The nocturia resolves.
Stress incontinence disappears. Menstruation that previously lasted 5 to 7 days normalizes to 3 to 4 days with dramatically reduced flow. The quality of intimate life improves markedly. Constipation and chronic bloating that patients had suffered with for years clear up. One exercise, one repositioning, a cascade of improvements across the entire lower body. The reason all of this is achievable lie in the anatomy I described. Remove the mechanical compression, lift the intestine, and the damn blood flows freely again.
The bladder is no longer under pressure, the uterus returns to its natural position, the gut regains normal circulation and function.
You are not treating 10 different diseases. You are fixing one structural problem. For the most complete and fastest results, the approach needs to be comprehensive. The exercise for lifting the organs needs to be combined with strengthening the abdominal muscles and the pelvic floor muscles. The muscles of the perineum, which form the hammock-like base of your pelvis.
The involvement of a nutritionist and an endocrinologist is important because ligament weakness and connective tissue weakness,
the structural failures that allowed the intestine to drop in the first place, often have metabolic and hormonal roots. Collagen synthesis,
addressing those deficiencies accelerates and sustains the recovery. Now let me give you the exercise itself. Pay close attention.
It has 3 precise sequential parts. Execute each part fully or you will not get the result. Part 1, exhale completely. Force every last cubic inch of air out of your lungs. Compress your chest, empty yourself entirely. Do not stop halfway. Force the exhale to its absolute end. Part 2, hold your breath at that full exhale. No air in the lungs.
In that moment of breath hold, draw your abdomen in as forcefully and as deeply as you possibly can.
The goal is to create a deep hollow just below your rib cage, a visible concavity where your belly normally protrudes. Pull it in as far as it will go.
Part 3. Bring the fingertips of both hands together flat, like a spatula or a wedge. Starting from the pubic bone.
The hard bone at the very base of your abdomen, use those gathered fingertips to physically lift the abdominal tissue upward, dragging slowly and firmly all the way to the navel. When you have completed that upward stroke, release the tissue gently back to its resting position. Only then, slowly through your nose, inhale.
Everything is slow.
Everything is smooth, no jerking movements, no rushing. The moment you start rushing,
you lose the therapeutic effect. The lift must be deliberate and complete, from the pubic bone all the way to the navel with firm,
steady pressure. The most common mistake I see is half effort. People breathe out a little, they pull their stomach in a little, they barely touch themselves.
That does nothing. The exhale must be maximal. The abdominal draw-in must be maximal.
The manual lift must be firm and intentional. If you reach the point where you feel a mild panic about needing air, that is correct.
That is the signal that you have emptied your lungs fully and the exercise is working. I have never seen a single patient do this perfectly on the first attempt. That is completely normal. With daily repetition, the technique improves, the capacity deepens. And as a secondary benefit, you are also building significant respiratory muscle strength. Your diaphragm and the... Some people are afraid they will injure themselves pressing on their abdomen. I want to address that directly as your doctor. You cannot harm yourself. Your finger pressure, applied manually to your own belly, cannot penetrate skin, subcutaneous tissue.
That's the dense fascial layer called the aponeurosis, which is essentially a thick sheet of connective tissue reinforcing the abdominal wall. And
the peritoneum is the membrane lining the inside of your abdominal cavity. To actually damage an organ,
you would need force that is simply impossible to generate with your own hands. If you feel discomfort anywhere, you ease the pressure instinctively.
Your nervous system handles that automatically. The same reassurance applies if you have had a surgical incision. If more than 1 month has passed since a cesarean section or any other lower abdominal surgery, your scar is fully formed and structurally sound.
In fact, pulling abdominal tissue after a surgical incision has a meaningful additional benefit. It stretches internal adhesions. Adhesions are bands of scar tissue that form inside the abdominal cavity after surgery. They can tether organs, restrict movement, and impair bowel function. Manually lifting and stretching the tissue mobilizes those adhesions, which can significantly improve intelligence. How often should you do this? At minimum, before sleep every night, 2 to 3 complete cycles. That means 2 to 3 full repetitions. For faster results, add a morning session. For even faster results, 3 times daily.
1 year of consistent daily practice is the time frame for a stable, lasting result. The ligaments that hold the intestine in position are slow to rebuild.
They do not recover in weeks. They need months of sustained mechanical loading and nutritional support to regain their holding strength.
The one exception, during menstruation, stop. Take those days off from the exercise. Your uterus is actively contracting
and shedding its lining during that window, and this is not the right moment to add mechanical stress to the pelvic structures. Expect some mild soreness in the abdomen after your first few sessions. That soreness is physiologically normal.
When you lift a prolapsed intestine, you restore blood flow to tissues that have been chronically underperfused.
Meaning blood has not been reaching them adequately for a long time. Newly restored circulation causes an inflammatory response in those tissues, which feel like a dull ache. It passes. It is your body waking up. Women may also notice some changes to their next menstrual cycle.
It may arrive slightly earlier than expected. The flow may be heavier or lighter than your baseline.
In rare cases, there may be light spotting between cycles that is unrelated to menstruation. This happens because the repositioned uterus now has... And the endometrium, the inner lining of the uterus that sheds during menstruation, adjusts to the new blood supply. This is not a warning sign. But if it concerns you, a visit to your gynecologist will confirm that everything is proceeding normally. Here is the long-term picture. This is not a 30-day challenge you complete and forget.
Gravity operates on your body every second of every day. Every time you lift something heavy, run, jump, or simply stand upright for hours, gravitational load is pulling your visceral organs downward. If you want a young, functioning face, you maintain it continuously. Skincare, protection, hydration.
Your intestine deserves the same logic. 2 minutes per day to mechanically maintain the position of your organs is not an inconvenience. It is basic anatomical maintenance. After approximately 1 year of committed daily practice, the most severe prolapse is corrected, the acute phase is resolved,
and the worst symptoms are eliminated. That change is visible
and measurable.
After that first year, the daily practice shifts from rehabilitation to maintenance, and that is a much lighter task. Now, one clinical observation that directly relates to your age, because this matters for how urgently you need to act on this.
Ligament strength and connective tissue integrity decline measurably after the age of 40. The supporting structures that hold your abdominal organs in their correct position
Are made of collagen, and collagen synthesis slows significantly with each decade past 40. Visceraptosis, organ prolapse, progresses faster in people over 40 simply because the tissues holding everything in place are weaker and slower to regenerate. How old are you? Write your age in the comments. I want to see where our viewers are in that risk curve. Because the answer shapes how aggressively I recommend starting this today.
Here is your clear, practical takeaway. Stop fighting your belly with ab crunches and calorie restriction. That is the wrong battle. The target is your intestinal position, not your fat layer. Start the 3-part exercise tonight. Full exhale, maximum abdominal draw in with a breath hold, slow manual lift from the pubic bone to the navel using gathered fingertips. Do 2 to 3 cycles before sleep. Add a morning session if you want faster progress. Be consistent for 1 year. If you have had abdominal surgery more than 1 month ago, do not skip this. Do it. If you are menstruating, take those days off. Monitor your symptoms, the swelling, the sleep interruptions, the menstrual duration, the digestive comfort.
You will see changes within 3 to 4 weeks. Real, measurable changes.
Not because of willpower or a stricter diet, but because you corrected a structural, mechanical problem that was generating most of your symptoms in the first place. While the medical system charged them for treatments that never addressed the root cause. Nobody wearing a white coat in a fee-for-service clinic is going to hand you this information. It does not generate a billing code. The truth is free, but only if someone is willing to say it. Subscribe, hit like, and help this channel reach 100,000 subscribers. That is how we keep the truth in circulation.